A study in Circulation found that 1 in 5 patients with cardiogenic shock still experience suboptimal outcomes despite advancements in therapy. How do you leverage technology like mechanical circuitry support to improve survival rates and patient recoveries?
It's a really difficult part of what we do when we realize that we cannot really help a patient stay with their families longer despite all the hard work we put. One of those unfortunate areas that we still have issues with in the areas of cardiogenic shock. In the best hands, the survival rate in patients that have cardiogenic shock is...
Hey everyone, welcome once again to Medical Success Secrets. This is Theo Harvey, co-founder of SensorMed, a remote patient monitoring program for practices and patients. But I'm super excited that I have a special guest today, Dr. Ongobayo, interventional cardiologist. How are you doing today, Dr. Ongobayo?
I'm doing great. How are you doing?
I'm doing wonderful. So thank you for joining us today. Yes, Dr. Ongobayo is an interventional cardiologist, and he's dedicated to advancing patient care, and he's really focused on inspiring others in social media with hashtags be greater than average, and he demonstrates a unique blend of clinical experience with compassionate care. And so I think this is going to be a great conversation around the changing state of cardiology, but more specifically, your expertise in sharing that out into the world. So one of the things that I really want to kind of get into, we work with cardiologists a lot. We do a lot of monitoring of patients with hypertension remotely, but a study in Circulation found that 1 in 5 patients with cardiogenic shock still experience suboptimal outcomes despite advancements in therapy. How do you leverage technology like mechanical circuitry support to improve survival rates and patient recoveries?
Thank you so much for that question. And it's a really difficult part of what we do when we realize that we cannot really help a patient stay with their families longer despite all the hard work we put into making sure that this is so. One of those unfortunate areas that we still have issues with is in the areas of cardiogenic shock. And cardiogenic shock simply is when the heart is no longer able to support the body's demand for nutrients, for oxygen, and generally unable to keep the body going. In the best hands, the survival rate in patients that have cardiogenic shock is still lower than 50%. And that's despite all the advancements we have had in the field of cardiology. Not a better time to talk about this because myself and my colleagues were just helping out a patient in cardiogenic shock after the patient had a heart attack. And thankfully, this patient is actually doing well. And that is thanks to mechanical circulatory support. And what mechanical circulatory support really is, their equipment and new technology that we have now that can really take over the function of the heart while the heart is trying to recover. And it's just like, using crutches when you break your leg. It's like using a patch to reduce the sun rays and light getting into the eye while the eye is trying to recover and get better. It does a little more because not just, supporting, making sure the heart is recovering, it also does what the heart is supposed to do. And so in this particular patient, we'll put the patient on ECMO, which basically is taking over the function of the heart. It's called extracorporeal membrane oxygenation. So we get the blood out, we put oxygen, and we send the blood back in. Now, many patients may not do well with just ECMO, especially if their heart is already weak. And this particular patient, their heart was really weak. So we had to support the ECMO with something called impeller, which is pretty much a machine that we put inside the heart itself. It sucks out the blood out of the heart, and it pumps it outside the heart to the different parts of the body. So it's gotten to the point now that technology advancement has allowed us to combine these powerful equipments to be able to keep a patient going. Now, when the patient got sick and had a heart attack, their heart function was around 10%. So pretty much the heart was not moving at all. Mind you, normal is around 55 to 60%. As at today, which is 3 days after they got really sick, their heart is now back to about 50%. And that is thanks to this novel therapies that we have now that can support the patients. Now, not every patient has access to this, and that is rather the unfortunate part, that not every hospital, not every center can provide some of these therapies. And so we still have a lot of work to do to be able to get more hospitals to adapt these novel technologies. And mind you, it does not come with its own issues. We've had to transfuse this TED patient multiple times because the impeller device, it rotates. And it rotates out. As it does that, it destroys some of the blood cells. So the patient's blood counts will keep going lower and lower and lower. And it takes a great amount of expertise to be comfortable in using this equipment. I had to employ the use of some of my colleagues and partners. We work together as a team. So teamwork is also very important. It's not just about the technology. It's about knowing how to use it. Even more importantly, knowing when to use it. And I think with these technologies, we've seen an uptick. There's some centers like ours that have a mortality reduction by using these technologies. Our mortality, our percentage of patients that make it out of the hospital is over 60%, which is higher than the national average. And so, yes, we're thankful that we have these technologies and we're able to use it for the advancement and the prolongation of the life of our patients.
I love that. You know, the triple aim in healthcare, right? Access, quality, cost. And I think US healthcare is probably have the highest quality when if you can deliver these new novel technologies and solutions to patients. But the challenge is access. A lot of folks don't get access, to your point. And then also the cost factor, right? And so I think that's always a balancing act when it comes to kind of delivering these life-changing, really novel technologies and helping patients, whether in the hospital or even at home. And so I know as a physician, I know you struggle with that, but I know you're also part of like organizations like the Association of Black Cardiologists, and you guys are trying to help with access, awareness, and things of that nature, maybe preventative. How do you balance, hey, we have the best quality, but not everybody can get access to it, by your work with these organizations to kind of help individuals and patients be more aware of what they can do now so they don't have to need those maybe higher quality interventions?
That's an excellent question, and thank you for asking that. And the reason why I say that is there are many associations out there that focus on getting patients the access they need to these novel technologies. And I think access really and always starts with education, because if you don't know that something exists, you're not even going to put yourself in a situation to try and get that thing.
Yeah.
I think the Association of Black Cardiologists that I'm a proud member of is really in the forefront of championing increased access through education, through providing these opportunities to the minority population in the United States. And I think they've come a long way in doing this. So we're not just increasing scholarships for minority doctors, because whether we like it or not, there's always going to be that connection when you see someone that you feel at least can relate to you in your community, can understand what you've been through, because you think that your struggles are identical or at least akin to one another at some point. Outside of that, they help with education. And another thing they do to increase access is actually providing the venues where some of these guys, some of us physicians can get trained, can increase the knowledge. Because remember now, there's a high degree of adeptness that you have to be at to be able to use some of this technology. So increasing proficiency for physicians themselves that can now pass across that knowledge that the ABC has allowed them gain to be able to help their patients is also huge. I think education is important on the patient side as well, because a lot of people don't even know the signs and symptoms of heart disease. Don't even know the signs and symptoms of having a heart attack. And you have minority populations who tend to overlook certain things, who don't pay attention to the subtleties that may exist in presentation of some of these diseases. So again, if you're hungry and you don't know what an apple looks like, or the fact that you can eat an apple and satisfy your hunger, is going to be right beside you and you don't know it. And that's where I think education comes in, and ABC is at the forefront. And I mentioned that because I'm a proud member, but there are many other organizations that cater to every American, international organizations as well that I'm a part of, that try to cater to people, not just in the US, but outside the US, who may not have access. Some of the things they do is things like Doctors Without Borders, increasing access in those areas. We have some things like that even here in the US, trying to provide access to patients that don't necessarily have that access or have the knowledge of the access in the first place.
I love it. Well, that's a good point. It's hard to have access if you're not even aware, right? So that's always the hidden thing. If you're not aware of what's out there, what's available for you, you probably won't even think to knock on the door to get access to it, right? And so I think that's a good point. So let's pivot a little bit into, your emergence on social media and putting your expertise out there. And obviously awareness is a part of that, I'm sure, for you. But yes, how did you get involved in that? We talked to a lot of physicians and a lot of doctors, inpatient setting, outpatient, and they're just hesitant, right? What made you decide to go out there and put your expertise out there to build a kind of a following, if you will, on your expertise?
Thank you very much for that question. I was just talking to a colleague today, and I said, we don't cure or treat ignorance with more ignorance. We don't bring light into darkness by taking our light away. The cure to darkness is light. And I'm from Nigeria originally, and I know what healthcare looks like back home. I know that a lot of people don't take good care of themselves because A, like you alluded to, they don't have access. And B, even if they did, they need to be able to recognize the symptoms and signs of diseases that they may have in order to get the care that they need. And so we need awareness. I think, there's a holy book that says, my people perish for lack of knowledge. And so, people want knowledge. People want to know. And the people that go through, you see the world we are in now is a world of social media. We all use it. We all soak it all in. We're on TikTok, we're on Instagram and things like that. And most often than not, what we watch there is different skits that make us smile, make us happy, make us enjoy life, right?
Yeah.
So if you have that platform, why not use it to educate people? You know what? This is what you get, and this is how you feel when you're having a heart attack. And this is what to expect when your cholesterol is high. These are the few things you can do to reduce your cholesterol, to do this and do this and do that. I think that we as human beings, whether you're a doctor, a nurse, even if you're not in healthcare, we have something that somebody needs. I've been fortunate that the good Lord has blessed me to get the training that I have and to know what I know. And even if it's one person that can get the help they need by listening to the video or to a skit or something that we put out there, then that is one person that's been saved. And there's many testimonies, if I might use that word. A lady a few years ago was like, well, I just watched this stuff. My husband was having that symptom. He ended up getting a stent. His life was saved. And that is why we're out there. We need to get knowledge out there. Something like what you were doing. Someone is going to get on your page and watch your videos, and by that get inspired to do something to help their community, to do something to provide access to their mother or their father. Oh, I did not know that we could sit at home and the blood pressure can be taken and their weight can be taken, and they can tell you to increase your water pill and things like that because of what you do. And because of your presence and putting it out online, people can understand that there's hope. People can understand there's easier access, and people can appreciate it and use it to their benefit. Ultimately, their health gets better and the whole world gets to be a better place because we're out there.
I love it. I love it. Well, and we talk about this a lot in this podcast about getting out there as doctors talk to patients, or just doctors communicating. Look at the 3 T's, right? Talk about your testimony.
And if I might add, before I forget, sorry to cut you. There's hesitation in the medical community because we continue to see that as a professional community. It's the same internet, the same TikTok, the same Instagram that you have comedians, right?
Mm-hmm.
People that go there and talk stuff and all that. And so from the professional standpoint, we're like, I don't want to be a part of that. It's just for joke stars and people that, just out there just to talk nonsense. But I think we need to start changing our view on that you can have a knife. A knife can be used for bad things and can also be used for good things.
Yeah,
so the question is, how do you want to use your tool?
It's a tool. I mean, some tools can be good and some tools can be bad. Just depend on the person wielding it. And you hit the nail on the head. You can only fight darkness, which is misinformation on the internet. During COVID, we saw so much misinformation. People who were not certified as doctors communicate wrong information and people got hurt. So to your point, I think coming in with intention into social media and putting yourself out there with the good intention, even though it may be awkward, maybe not what you're used to. You may even get some arrows sling your way with people comment. But to your point, you fight that light, right? You fight that darkness with your light. And I love that.
Sure.
And we always talk about, and I think I'm going to throw another T in there. You just brought this up to my mind. 3 T's are just communication, right? Tell a testimony, right? What's the importance of this? Tell your truth, and then also share and be very transparent. And then, I think that helps to kind of keep patients engaged and trust you more and more over time. So, Dr. Ongobayo, this has been great. Where are you next? Where can people find you and all that?
Well, I am in Danville, Kentucky. That's my employer is from McDowell Health. They're doing wonderful things here south of Lexington, Kentucky. There's a lot of disease here. And, when I got here, the administration was down with, making access easier, making our care better. We now offer a non-invasive way to assess the arteries of patients' hearts without having to do a heart cath. That was something they committed to when I came here because I told them I think it's the next level. And despite how sick patients are, we're able to take good care of them, 0 to 100 in-house. I think that's amazing. I use Instagram a lot. My handle is Dr. Balls, Dr. the doctor, Gbolls. I'm also a person of faith, and I like to write. So you'll see a lot of things that I write on there. And sometimes I get vain. I talk about my amazing family, I think. It's always a good thing to remember your roots and see the people that support you so that you're able to do what you do. I think it's a one-stop shop for me online. But I think my passion is still helping people. I know professionally I'm a physician, but there's so much sickness out there, not just from the heart standpoint. There are people that need help and that need to pick me up, that need a word in time, a word in season. And when I get those inspirations, I write as well. So that's what I do.
Well, thank you so much for your time. I really appreciate it. Look, everyone, this is great information. Fight the darkness with your light. Don't give up. Put your information out there if you're a healthcare professional or you're aspiring to be one. Hopefully you like this podcast. Go listen to other podcasts. We talk to other great professionals as well that can kind of guide you in this new normal of healthcare. Thank you for your time.
Thank you.